Hello, and a really warm welcome to you. I'm so glad you're here. Just taking the step to learn about something as personal as pelvic pain, well, that takes real courage, so I just want to acknowledge you for that. Together, we're going to walk through this topic in a gentle and supportive way, using clear, kind information. I love this quote, and it's really going to be our guiding star for our time together. It comes from Dr. Farzana Khan, the expert whose compassionate work we're exploring today. It just sets the perfect tone, doesn't it? This is all about a partnership built on trust, on clarity, and on care.
So with that in mind, let's get to know the expert behind this wonderful approach. We're going to take a little look at her journey in women's health because understanding where she's coming from helps us see the incredible depth of experience she brings to this really important conversation.
You can see here, Dr. Khan's dedication, well, it spans over 2 decades. It all started with her medical degree way back in 2003. And from there, she's added specialized qualifications like a diploma in sexual and reproductive health. And today, she's not only caring for her own patients, but she's also training other doctors. That really says a lot, you know? It shows her level of expertise and her deep commitment. This is the kind of foundation of trust we're building on here. Okay, let's gently move into the heart of things, because before we can even talk about healing, it is so important to understand why this pain might be happening. And I really, really need to be crystal clear about something. Your pain is real. It is completely valid. It is absolutely not all in your head. We're about to explore the actual biological process that can cause pain to stick around. And this is where things get really fascinating. What we're looking at is a biological loop that the body can actually learn. It often starts with a totally understandable fear of pain. That fear can make us hyper-aware, constantly on the lookout for it. Our body tries to protect us by tightening the pelvic muscles. It's a reflex called guarding. But here's the tricky part. That very tension can make the pain worse, which then confirms our original fear, and so the cycle begins again. And please hear me when I say this. This is not a personal failing. It's a protective system that's just working a little too hard. This brings us to a really key idea called central sensitization. Honestly, the best way to think about it is like your nervous system has a volume dial for pain, and for some reason, that dial has been turned way, way up. It gets so sensitive that it starts to misinterpret normal, gentle sensations like touch as being dangerous and painful. Understanding this is such a game changer because it means we can learn how to gently turn that volume dial back down. So, the big question is, how do we start turning that dial down? Well, one of the most powerful and gentle tools we have is something called mindfulness. It's all about retraining the brain and, most importantly, giving you back a sense of control over how your body is interpreting sensations. And this is how it works. Mindfulness is what helps us press pause on that pain-fear cycle we just looked at. By just being in the present moment, you can start to quiet down that catastrophizing, that spiral of worrying about what might happen. It helps create a little space, uncoupling the physical feeling from the immediate "oh no" emotional reaction. This in turn helps lower that protective muscle tension and teaches us that we can handle these feelings as they come and go. So what's the goal here? It's really not about forcing yourself to relax or making the pain vanish on command. It's so much simpler than that. It's about just noticing. Can you observe a sensation? Maybe it's warmth, maybe it's tightness, and just let it be there for a moment without automatically labeling it as bad or threat? That tiny shift in awareness, it's incredibly powerful. Building on that idea of gentle awareness, let's talk about another really powerful tool. It's called graded exposure, and it's a very respectful, step-by-step way to gradually reintroduce touch and rebuild that essential trust in your own body. And the best part? It's all at your own pace. Here's just a sample of what that might look like. And notice how gently it starts, just looking, with no judgment and no touch involved. The most important thing here is that you are in complete control, always. You only ever move to the next step when the one before it feels neutral and safe. This whole process is about reteaching the brain's threat system, showing it that these things are actually safe, not dangerous. There's no rush, no pressure. You're in the driver's seat. Okay, let's just pause for a second on this one, because I'm willing to bet many of you have heard this before, right? It's usually well-intentioned, but it can feel so dismissive, so frustrating, especially because for most women, it just doesn't work long-term. Let's take a look at why that is. Let's break down the myth versus the clinical reality. Sure, a glass of wine might numb things for a little while, but it doesn't do anything to change that sensitive nerve response we talked about. In fact, alcohol can actually dehydrate tissues, which can make things worse. On the flip side, clinical mindfulness is an active skill you build. It gives you lasting control and actually retrains how your brain interprets sensation. And it uses real tools, like mindful breathing, to send a signal to your nervous system to truly let go of that guarding. It's the difference between avoidance and empowerment.
Okay, so where do we go from here? Let's bring everything we've talked about together and look at a real, practical path forward. We're going to talk about the concrete steps you can take and all the wonderful support systems that are out there to help you on your journey.
And the wonderful thing is, you can start making gentle changes today, right from the comfort of your own home. Even something as small as 5 or 10 minutes of a guided mindfulness app each day can start to make a difference. Practicing slow, deep belly breaths is a beautiful way to soothe your whole nervous system. And journaling can be a lovely way to just notice patterns, again, without any judgment. These are gentle, accessible first steps just for you.
And this is so, so important. Please know you don't have to walk this path by yourself. There is an entire network of professional support available. Pelvic health physiotherapists are incredible specialists. There are things like NHS pain management programs designed to give you comprehensive support. And of course, all these approaches work hand in hand with medical treatments for any physical issues. Having an integrated team on your side is so often the key. Wow, we've gone through so much together, from the science of pain to these gentle, powerful tools for healing. So I just want to leave you with this question to quietly reflect on. This isn't about doing everything all at once. It's about finding one small, manageable action that feels kind and right for you. So what is the first gentle step that you feel ready to take today? Thank you so much for sharing this time with me.